So you're here for your annual physical examination. Do you know when was your last examination?
Probably last year around this time.
Okay, that's perfect. Was there anything abnormal?
Not at that time.
No. Okay, great. Can you go ahead and confirm your date of birth for me?
Yep, it's September 7th, 1998.
Okay, and full name, please.
It's Olivia Annan, A-H-N-E-N.
Okay. Okay, so I'm just going to confirm a few things before we get started about your medical history. Do you usually drink alcohol?
Yes.
Okay. How many drinks a week would you say?
Like one
Okay.
to two.
Do you smoke?
No.
Do you vape?
No.
Have you ever smoked or vaped?
Nope.
Can you go ahead and confirm your height for me?
5'9".
Okay. Okay. Do you exercise?
Yes.
What kind of exercise do you do? Do you do like high intensity or more like yoga, Pilates?
I run and I also do Pilates.
Oh, okay. How many times a week?
Usually 3 to 4.
3 to 4. Perfect. Okay. Is there anything that you would like to address today specifically?
I've been having some knee pain.
Okay. When did that start?
Probably a couple months ago.
Okay. Does it bother you more when you're running after a run usually? Or
Yes.
okay.
Yes.
How many times a week do you run?
Usually once.
Okay. Okay, I'll definitely take a look at your knees, your joints, make sure everything's good there. Okay, I'm going to start taking your vital signs now. Taking your blood pressure. Just going to slide this right here. Just going to, there you go. You can go ahead and relax. Can you go ahead and uncross your legs for me, please? Okay, that's 100 over 70, which is completely normal. Just taking this off your arm. I'll be placing this on your finger. You can go ahead and relax. Okay, I'm going to take your temperature. Okay, 7.6. Oxygen level is 97. That's great. And your heart rate was 82 beats per minute. That's normal. Okay. Let's start taking a look at your eyes. We're going to be checking your pupils. I'm just going to be measuring your pupils. I'm going to place this right here. Okay, so we have about 2 millimeters. Pretty symmetrical. Okay. They are dilating and constricting normally. They're round and consensual. So that's great. I'm going to ask you to please hold this up to your eyes. We're going to be doing some tests. Yeah, just like that. I'm going to be holding this right here in front of you. Can you tell me if you can see right now?
I can.
Yeah. Can you make out any of the letters?
Yeah. Should I start lowest?
Just read this row for me.
LTFPH.
Okay, perfect. I'm going to be opening this up. Okay, now we're going to do the same thing. Can you still see? Same?
Yep.
You can go ahead and read this last row for me.
LTFPH.
Okay, what letter is this one?
J.
This one right here.
C. Z.
Okay, perfect. We're going to go ahead and switch it this way. We'll do it open like that first. Can you take a look at this? Let me know if does it look the same as before?
Yep.
Go ahead and read this last row.
LTFPH.
Okay, you can go ahead and read this one backwards. So starting on the right.
JHDFC.
Okay, perfect. Now we're going to be closing this. Okay, can you still see?
Yeah.
Go ahead and read this one backwards for me. So starting on the right.
HPFTL.
Okay, go ahead and read this one starting on the right as well.
OZTFE.
Okay. Okay, I'm going to grab this from you. Okay. I'm going to take a look inside your eyes. Go ahead and just look straight ahead. Okay, the optic nerve looks intact. Retina is free of any scratches. It's clear as white. No signs of inflammation. Take a look at the other one. Okay. Okay, again. Optic nerve looks intact. Clear as white, not inflamed. Very good. Now I'm going to be touching your face. I want to make sure that we don't feel any lumps, any masses, anything that could be abnormal. You also look up for me, please. Okay, conjunctiva looks normal. Go ahead and look down. Okay, everything looks normal. You can go ahead and relax, close your eyes. I'm just going to be palpating the face, making sure I don't notice any lumps, masses, muscle wasting. Checking your lymph nodes. If there's any pain, please let me know. Go ahead and clench your jaw for me. Okay. Okay. Now go ahead and try to turn your head towards your left. Just placing some resistance. That's great. Let's try the other side. Okay, very good. Okay, now I'm going to take a look at your ears, and I'm going to be doing a hearing test as well. Okay, and just look straight ahead. Okay, can you turn your face a tiny bit? Thank you. Okay. The membrane is pearl gray. Your ear canal is free of any obstructions. There's no inflammation. No wax buildup. Look at the other side. Okay. Okay, tympanic membrane again is pearl gray. No signs of inflammation. Your canal is clear. Very good. Okay, now I'm going to be doing a hearing test. Okay, I'm going to ask you to please close your eyes. I'm going to be making a sound with a tuning fork. Know if you can hear this. Can you hear that at all? Yeah. Okay. Okay, now let me know if this sounds closer or this. That. Okay. Let me know if this is closer or this.
That one is.
Okay. Now I'm going to ask you to tell me when it stops. I'm going to place it right here. Now let me know when you stop hearing it.
I stop.
Can you hear that? Okay. Know when it stops.
Stop.
Okay. Can you hear this? Okay. I'm going to be placing it on top of your head. Know if you can hear this equally on both ears. Yeah. Okay, I'm going to do that one more time. Yeah. Okay.
Yeah.
Now I'm going to be making a sound close to either the right or left. Just let me know which side you hear it on. Right? Okay. You can go ahead and say right or left, please.
No. Right. Left. Right. Both. Right. 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 Left. 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 On top, like top.
Okay.
Left. Right. Right.
Okay, now tell me if this sounds closer or this.
The first one.
Okay, does this sound closer or this?
First one.
Does this sound closer or this one?
Second one.
Okay, perfect. Okay, now I'm going to be checking the reflexes on your face. You can just go ahead and close your eyes. Let me know if there's any shooting pain, any abnormal response that you feel. Go ahead and turn your head towards me. Just gonna place your head back. Okay, now I'm going to be taking a look inside your mouth. Okay. You go ahead and say ah for me. Ah. Oh, okay, very good. Okay, I don't notice any mouth sores. The gums are not inflamed. That's great. I'm going to place one of these on your tongue. Just let me know if you can detect it being bitter, salty, sweet, if it could possibly taste like nothing. So go ahead and let me know what it tastes like. You can close your mouth so you can taste it properly. I'm gonna take it out. Did that taste like anything?
No.
No? Okay. Okay. The same thing. Nothing? Okay. Does it taste like anything? No? Okay. That's fine. It's okay. Don't worry. Let's try one more.
It tastes a little better.
A little bitter. Okay. Just gonna make note of that. Okay, now I'm going to give you a few different scents for you to smell. You tell me if you can describe to me what it smells like. First, go ahead and cover one of your nostrils and take a deep breath. Make sure there's no blockage. Go ahead and do the same thing. Okay, and try this one.
It smells like Vicks Vapor Rub.
Yeah, it's eucalyptus. Okay.
Peppermint.
Mm-hmm.
Can I do that one more time?
Yeah.
Lavender.
Mm-hmm. Very good. So smell is normal. Okay. Okay, now I'm going to be checking your facial sensations. So I'm going to ask you to please close your eyes. I'm going to be touching your face with this object that should feel a little bit cold. Just let me know if you feel it on your right, left, or both.
Left. Right. Chin. Right. Left. Left. Right. Both. Nose. Left. Right. Left. Right. Chin. Right.
Okay, very good. Now we're gonna do something similar. I'm gonna be touching your face with these brushes on both sides. Just let me know if it feels the same. Feel the same on both sides?
Mm-hmm. Mm-hmm.
Yeah.
Yes. Yep. Yeah.
Okay, perfect. Okay. So we checked your eyes, pupils, ears. Cranial nerves are normal except for your taste. But that could also just be there are a few substances that some people can taste and some people cannot, and it's just due to the gene that might be present or not present. So I'm not really concerned about it. Okay. I'm gonna be checking your heart. Just gonna take all this off. This is right here. Can I ask you to take a deep breath for me? Exhale. Okay, go ahead and take a deep breath. Exhale. Very good. I'm just going to place this right here on the side. Go ahead and take a deep breath. Exhale. Okay. Take a deep breath. Exhale. Okay. Everything sounds normal there. I'm going to ask you now to go ahead and take go ahead and lay down on the bed. I'm going to be checking your scalp, abdomen, your back, and your knees. Okay?
Okay.
Okay, let me just get this out of the way. I'm going to be checking your scalp here. Just want to make sure that there's no irritation, no abnormal skin marks. Okay, I still see a few sunspots in this area. Grab my magnifying glass. Okay. I've got 3 spots. Taking a measure here. This one's 2 millimeters, about 2. It's pretty round. Just want to make make sure that it's not raised. Okay, it's flat. This one here seems like it has some accumulation of oil. However, there's the inflammation, no lesion. This is 1.5 millimeters by 2. Go ahead and take a sample just to rule out any scalp conditions. Okay. I'm going to be testing this for any skin conditions, psoriasis, eczema. Okay. This third spot in here. Let's see. I'm going to take a measurement of it. It looks pretty similar in size. So yeah, we've got 2 millimeters by 1.5. Yeah, a little closer look. Looks pretty regular in shape and color. Okay. Okay. Everything else looks healthy. I'll be doing a couple of sensations tests. I'm going to be touching your scalp with either a sharp object. This is going to feel sharp. Can you feel that? And this is going to feel dull. Can you feel that? Okay, I'm going to be asking you if you feel sharp or dull. You can just go ahead and let me know. How does that feel?
Sharp. 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 Dull. Dull.
Did you feel this?
Yes.
Did it feel sharp or dull?
Dull. 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 Sharp. Sharp. Sharp.
Okay.
Sharp.
Okay.
Sharp. Sharp. Dull. Dull. Dull.
Okay, and I just want to make sure that you can perceive vibration. So I'm going to be placing the tuning fork on your scalp. Just let me know when you stop feeling the vibration. You can just say no when it stops.
No. 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 No.
Okay. Okay, now I'm going to be taking a look at your abdomen. Okay, I'm just going to pull up the gown a tiny bit. Just going to be taking a look at your abdomen. First, I want to make sure that I don't notice any scars. Have you ever had any surgeries?
Not in my abdomen area.
No. Okay. Don't notice any scars. There's a tiny mole here. I do want to take a measurement of. So, 3 millimeters by 2. It's pretty symmetrical in shape. It's a little bit raised from the skin. Dark brown in color. Okay. Could be listening to your abdomen. I can hear all normal bowel sounds, so that's completely normal. Now I'm going to be palpating the abdomen, trying to feel your major organs, just making sure that they're not inflamed. So here I'm just looking at the spleen. Can you go ahead and take a deep breath for me? Exhale. Okay, here it is. Feel smooth edges, normal size. Very good. Just going to try to find your liver on this side. You can go ahead and take a deep breath. Exhale. Okay. Yeah, it's not enlarged or swollen. Okay, that's great. Just gonna palpate, making sure there's no inflammation. The colon, intestines. Okay. I'm gonna be tapping lightly. This is just helping me hear the organs and determine the size of your major organs. Okay, I think that's normal here. Go ahead and cover your abdomen. I'm going to be taking your pedal pulses on your feet and checking your Babinsky reflex as well. Just going to make sure there's no inflammation here. Okay, everything looks normal. I'm going to be taking your pedal pulses. Okay. Pretty symmetrical. Okay, they're symmetrical and normal. Just taking a look at your left foot. Don't notice any signs of edema, no inflammation. It's all very normal. Okay, I'm going to be testing your Babinsky reflex. So basically, I'm stroking your foot and looking for that response. Okay, there it is. Okay, Olivia, now I'm going to be taking a look at your knees. First, I'm just going to be palpating. Just making sure I don't notice any inflammation. Is there any pain as I'm pressing right now? No, right now. Okay. I'm gonna be tapping on them lightly. Let me know if you feel any like shooting pain. Okay. Okay. Gonna be lifting your foot a tiny bit. You can just keep it right there. Gonna be pushing the leg. Does that hurt?
Mm-mm.
Gonna be pushing the other way. Does that hurt?
Nope.
Let's try to bend it a tiny bit. Gonna do the same thing. Does that hurt?
Nope.
Does this hurt?
No.
Okay. If I push right here, does that hurt?
No.
Here.
No.
Here.
No.
Here.
No.
Okay. We'll go ahead and rest that. To the other one. So I'm gonna be pushing like this. Does that hurt?
Nope.
No. Let's try this.
No.
Does this hurt?
No.
Okay. And push here. Does that hurt?
No.
Does this hurt?
No.
This.
No.
This.
No.
Okay. Do notice a tiny bit of inflammation right here. Go ahead and relax. I'm going to be listening to the joint. Okay, I'm going to lift this a tiny bit. Just let the weight on my arm. Okay. There's really no cracking on the joint that I can hear. I'm going to be bending it a tiny bit. Okay. There's no pain there either. No cracking, I'm sorry. Okay, can you go ahead and push on my hands with your... Does that hurt at all on your ankle or your knees?
No.
Okay. Okay, it just might be that they're a little bit sore. When you run, we can also take a look. Next time you come in, bring your running shoes with you.
Mm-hmm.
You can take a look at them. Maybe they're just not giving you enough support. Okay. Okay, Olivia, you can go ahead and sit back up on the bed. We're just going to discuss the results. Okay, I'm just going to take a few notes here. Pupil pulses were normal. Capillary refill swell, no signs of edema, no cough, tenderness. Your lungs were normal as well. Scalp was normal. Okay, so from what I found, you're perfectly healthy. This pain on your knees, it could just be be some inflammation on them. Could be the shoes that they're just not supporting you as much as they should. But I can give you an anti-inflammatory. Maybe you can take that when it hurts after running, and we can see if that helps. It just gives us some information to go with. Okay?
Okay.
Do you have any questions for me?
I don't think so.
No? Okay. So if something else comes up, come see me. Maybe in about a month, it would be a good idea to take a look at your knees again. Other than that, for your annual, everything's healthy, so I can see you again for an annual next year. Okay?
Perfect.
Okay. Thank you. Nice
Thank you.
meeting you.
Nice meeting you.